Good evening, ladies and gentlemen. Good evening, Lucy. I saw your message. A big thank you to everyone for joining us tonight to listen to tonight's webinar organized by Sage Counselling Centre. I hope everyone has had a good dinner and are ready for the talk. So 大家晚上好，非常感谢大家今晚参加由乐龄辅导中心举办的讲座。我希望各位都吃饱了晚饭，并且放松一下，来听听今晚的讲座。大家晚上好，非常感谢大家今晚参加由乐龄辅导中心举办的讲座。我希望各位都吃饱了晚饭。So tonight's topic revolves around mental health and longevity. I am sure many, if not most of us, are here because we want to find out about how to live a long life. So we hope you will be able to learn something and even share your learnings with your friends and family too. But before that, I know that there are some friends joining us online for the first time today. Please allow me to take some time to share about Sage Counselling Centre and what we do. So 今晚的主题是心理健康与寿命有关。我相信各位都想了解怎么延长寿命，所以报名参加今晚的讲座。希望大家能从主讲者身上学到更多的知识，也鼓励你们跟亲友们分享今天所学到的。那今天有些朋友们是首次参加我们的讲座，所以我来分享有关乐龄辅导中心的讲座的工作。As our name suggests, one of our key services lies in counselling. It is free for Singaporeans and permanent residents aged 50 and above, as well as their caregivers and family members. We are located at Jurong Point Shopping Centre next to Boon Lay MRT station. Secondly, we have the Seniors Helpline Service that is accessible to anyone that has a phone, regardless of your location. Anyone who would like a listening ear can call in and share about your challenges with our trained volunteers, or simply just to chat is also okay. We also have public education, such as today's talk. Next, a lot of our services involve volunteers, so if you are interested, we also provide volunteer training. 首先，辅导是我们的主要服务之一，免费提供给50岁及以上的新加坡人和永久居民和他们的看护者和家庭成员，通过面对面辅导或者是用电话辅导，提供讨论问题的平台。另一项服务是我们免费的乐龄援助热线，适用于想找个聆听者的年长者。那经过训练的义工可以用不同的语言和方言与你沟通。我们也提供公共教育服务，例如今晚的讲座。接下来我们很多的服务都由义工来执行。如果你有兴趣，可以报名，我们也会提供培训。我们也提供公共教育服务，例如今晚的讲座。The next few services and programs are very popular. We have the home maintenance service that offers free basic home maintenance and repairs for seniors who have a Blue Trust card, are receiving community assistance, and are living in 3-room flats or less. We do repairs such as fixing light bulbs, leaky taps, and more. We also have arts and culture programs and a reminiscence walk that brings seniors out to tour different cultural and heritage sites. We also have expressive therapeutic art and the music ambassador program. 那接下来，如果年长者家里的灯泡坏、水龙头之类的东西坏掉，我们会提供免费的电工、居家及水管的维修服务。只要是50岁及以上的新加坡公民或永久居民，而且拥有蓝色社保卡或受社区关怀基金的援助，住在3房式组屋以下，就可以前来申请。另外，我们也提供艺术和音乐的项目，这些是照顾年长者的社交和情感健康的治疗性活动。我们也有其他有关艺术和音乐的治疗性活动。另外，我们也提供艺术和音乐的项目，这些是照顾年长者的社交和情感健康的治疗性活动。OK。 刚才有一点回音，我找一下，应该没有了。OK。Okay, so next month we have a new run of our guided autobiography program designed to help seniors write and share their life stories. So it is a meaningful journey of self-discovery, reflection, and celebration as they connect with their past, entering the future with a sense of purpose and appreciation of life. If you are interested, please call or email us. 下个月我们会有一个我的自传创作小组节目，这项节目为年长者50岁以上提供叙述个人故事的机会。那通过回顾个人的经历，帮助年长者为过往喝彩，发掘人生的方向，并展望未来。大家可以致电或发电邮给我们，了解更多或者报名。Okay, please also note that we have an advisory on personal data protection. So during this talk, photos and videos of you may be taken for publicity, training, and marketing purposes. 我来说一下个人资料保护法令。我们会拍照和录视频，以进行宣传、培训和营销的活动。We would also like to gently remind our audience of a few pointers. So the attendees' video functions are disabled during the webinar. Please also do not record this talk in sound, video, or photography as contents of the talk are subject to copyright or may contain sensitive information. If you have any questions, you can please leave them in the chat box below, and we will try to post a question on your behalf during the Q&A segment, which will be after our speakers have presented. So we apologize in advance if we are unable to answer all your questions and seek your understanding on this. So 在这里也温馨的提醒大家，在讲座的过程中，视频功能被禁用，请不要以声音、视频或摄影形式录制讲座。大家可以把什么问题留在聊天室或 Q&A 里，我们在问答环节中代问。Okay, so for everyone who just joined, thank you for joining us tonight in this positive outlook lead to longevity organized by Sage Counselling Centre. So 再次感谢大家参加乐龄辅导中心的讲座，乐观能否延长寿命？ So let me now introduce our first speaker, Professor Ko Woon Tae. So Dr. Ko is a professor in the Healthy Longevity Translational Research Program at Yong Lu Lin School of Medicine at the National University of Singapore. So being a population health scientist, Professor Ko's research lies in studying the epidemiology of chronic diseases of importance to Singapore. So she is the principal investigator of the Singapore Chinese Health Study, a 63,000 strong cohort of middle-aged and elderly Chinese Singaporeans established for the long-term study of dietary and environmental determinants of chronic diseases common among Singaporeans. So she has also co-authored more than 420 scientific papers on risk factors of cancer, diabetes, cardiovascular diseases, osteoporosis, osteoarthritis, and adverse aging outcomes. So 我来介绍一下第一位演讲者，许教授是新加坡国立大学杨洛林医学院健康长寿转化研究项目的教授。作为一名人口健康科学家，许教授的研究兴趣是研究新加坡慢性病的流行病学。他是新加坡华人健康研究的首席研究员，并研究由63000名中年新加坡华人组成，旨在长期研究新加坡人常见慢性病的饮食和环境因素。他与人出版了420科科学论文。Okay, the second speaker is Dr. Feng Qiu-shi. So Dr. Feng is an associate professor in the Department of Sociology and Anthropology at the Faculty of Arts and Social Sciences in the National University of Singapore. So as a sociologist, his research interests are in aging and health, population studies, and economic sociology. He has co-authored about 100 scientific papers and book chapters in these fields. So he is currently leading a MOE Tier 2 project, Lifelong Education for Aging Productively in Singapore, and is the PI in charge of Social Determinants of Health for SG70, a multidisciplinary project on aging launched by NUS Yong Lu Lin School of Medicine. 第二位演讲者是冯秋实副教授。冯教授是新加坡国立大学艺术与社会科学学院社会学和人类学系的副教授。作为一名社会学家，冯教授的研究兴趣关注于老龄和健康、人口问题以及经济社会学。在这些领域，他参与发表了近100篇学术论文和书籍章节。他是新加坡教育部资助的终身学习和多产老龄项目的首席研究员。他也参与了新加坡国立大学杨洛林医学院的 SG70项目，负责老年健康的社会因素研究。好的。那介绍完两位教授，我就会把时间交给徐教授了。So now let me pass the time to Professor Koh. Professor Koh, please.
Slide sharing?
Yes.
Yes. Okay. A very good evening to everyone. I want to thank Marita for the kind introduction. It is such a pleasure to be here today. I wish I can see all of you, but I hope that even though you are only able to see me on the screen, you'll find the talk helpful. I will be speaking in English, and my colleague and a very good friend, Professor Feng, will present our findings in Mandarin.
大家晚上好，我们非常高兴，非常荣幸参加今晚这次活动，希望我们的演讲会给您带来收益。今天晚上的演讲，许教授将用英文演讲，我呢来帮许教授做中文的解说，谢谢。
Well, Prof Feng is too humble. He's not just doing the translation for me. The research that we are presenting is a project that we did together, and it would not have been possible without his partnership.
虽然表面上看来我是许教授的翻译，但实际上我们是多年的合作伙伴。谢谢。
谢谢。好。All right, let's start by going through 2 questions. So I would like all of you to do this simple questionnaire with me. Just 2 questions. And if you can pick up your handphone and scan the QR code here, you'll be able to use your handphone to respond to the questions that we will pose.
我们首先想请问您2个问题，很简单的2个问题。如果您手上有手机的话，请您扫描这个屏幕上的2维码，然后根据2维码提示的问题来回答。
Okay, we'll have a few seconds for all of us to do it. So maybe to go pick up the phone and scan this QR code. If you are unable to do this, it is all right. I hope you will also think of the answer and participate in our discussion.
如果您身边有手机的话，请您扫描这个2维码，回答这2个简单的问题。如果您没有手机也没关系，请您做好准备，一会儿参与我们对这些问题的思考。
All right, so the first question is, very good. The first question is, do you think you are in good health?
我们的第一个问题是，你是否认为自己的健康良好？
So you can either say, yes, I am in good health. No, my health is not good. Or you can say, well, it's okay, I'm all right, So that is a neutral response.
您可以选择说我的健康很好，您也可以说我的健康不太好， 或者您觉着我的健康不好不坏。
All right, so we have 43% of our participants who feel that they are in good health, 17% do not think they are in good health, and we have 39% who feel that they are kind of, all right, neither good nor bad.
根据统计结果，43%的听众呢认为健康良好，17%认为健康不好，有39%认为他们的健康不好不坏。
好， That second question.
第二个问题
Are you happy with your life?
你是否很开心？你的生活是否很快乐？
Wonderful. So we can see that, about 2 in 3 participants here feel that they are happy with their life. Only 4%, very few of you, feel that you're not happy with your life. And about 1 in 3, almost 1 in 3, feel that you are neither in a happy nor sad state, in a neutral state.
太好了，今晚的3位听众中的2位啊，会认为自己很快乐，另外1位会认为自己既不能说快乐，也不是不快乐了，只有很少的4%的人认为自己不快乐。
Yeah, so I'm very happy that one of the things that make you happy this evening is to be able to attend this webinar together.
我们非常高兴看到这样的结果，希望我们今天晚上的讲座啊是能让您开心的事儿。
However, are you surprised by the answer to these 2 questions? Only 43% of you think you are in good health. So how can 65% of you be happy? So if you don't think you are in good health, or you are just, in neutral health, could you still be happy with your life? Shouldn't you be healthy to be happy?
您看到刚刚这样的调查结果，是不是觉得有一点惊奇呢？因为只有43%的人认为自己是健康，可是对照下来，有65%的人认为自己很快乐。我们经常认为，只有觉着快乐的健康的人才会觉着快乐，可是根据今晚的这个统计结果，情况并不是这样。
Which is why today's talk looks at this question. Does positive outlook lead to longevity? Does your outlook of life affect your outlook? Affect your chance of living a longer life?
这就是今天晚上我们演讲的主题，是不是乐观积极的心态会导致您的长寿呢？
So, and to answer this question about longevity, we are talking about living beyond 85 years old.
为了回答这个问题，我们今晚要向您展示呢，要看85岁以上的年长者的情况。
So I don't know how many of you are above 85, but if you are above 85 years old, in the research literature, in the scientific literature, there is a special term for this group of older adults. They are called the oldest old.
我不知道今晚有多少我们的听众呢是85岁以上了已经。如果您85岁了，我们在学术上有一个特殊的名称，我们叫您老年。
And we know that the number of citizens in Singapore who are 80 and above have actually almost doubled in the past 10 years. So here we see the bars indicating number of citizens 80 and above. So we don't have the number for 85, but 80 is close. And we see from 2011 to 2021, a very steady increase in the number of people who are in this age group, 80 and above. And this increase is both in the women, in the lighter bars, as well as in the men here in the darker bars.
我们的这幅统计图呢，跟您展示了80以及80岁以上新加坡公民的人口数量。我们可以看到，从2011年到2021年，80岁及以上的老年人口数量近乎于增长了2倍。在这个过程中，我们看到不仅仅是男性的在增长，女性也有增长。在这个图中，较浅的颜色代表的是女性，较深的颜色代表的是男性，两者都有增长。
And we know that on average in Singapore, women can live to about 85 years old and men can live to about 82, 83 years old. So we do expect more and more older adults living beyond 85.
我们都知道，目前新加坡老年人的预期寿命，女性大体上是85岁，男性大体是82到83岁。我们预计有越来越多的老年人可以生存过这样的一个叫老年的阶段。
But how do you measure successful aging in this group? Are they considered to have successfully aged just because they crossed 85 years? I show you a picture of 2 elderly men here. If I tell you that they are both 86 years old, would you believe? I'm sure you say yes, it's believable because there are some who live beyond 85 in good health, and there are some who don't live beyond 85 in good health, but they can still make it beyond 85, but they are not healthy, they are in a wheelchair, they are very dependent.
我们想问您一个问题，那么什么才能叫做在这个老年群体中实现了成功老龄呢？我们怎么样来测量成功老龄呢？在以下的2个图片中，我们展示了2个场景。这2位老人呢，都是85岁以上了。从图景上可以看到，85岁以上可以是很健康的，也可以是未必那么健康的，都是有可能的。那么我们如何来测量成功老龄呢？
And more importantly, how do measures of successful aging affect survival beyond the age of 85 years? After crossing 85, what factors determine whether this elderly is going to reach 88, 90, 95, or even 100 years old?
更重要的是，什么样的测量能更加有效的来去预测我们可以活过85岁、90岁甚至100岁的高寿呢？
So there are objective markers of successful aging. If you ask a doctor, the doctor will say, successful aging, well, you must fulfill 3 criteria. You must have successfully avoided major diseases and disability. You must be able to have high physical and cognitive function, and you are able to have active social and productive engagement. And I think here is the late Queen Elizabeth of England. And I think we can all agree that up to her death at the age of 96, she had markers of successful aging.
我们可以看到，测量成功老龄，首先我们可以有一些比较客观的指标。这些客观的指标可以分为3类。第一类是无病无残，第2类是较高的生理和认知功能，第3是活跃的社会参与和活跃的经济生产能力。根据这3种指标，我们可以看到这个照片上，伊丽莎白女王其实是满足这样的成功老龄的客观指标的。
However, some of you might say, well, how about happiness and mental health? So indeed, there are also subjective markers of successful aging. And I think you will all agree that to have aged successfully, there must be life satisfaction. There must be positive perception of one's health, function, and well-being. Simply put, the elderly must feel happy with good emotional, psychological, and social health. And again, I show you pictures of some elderly who may not be that healthy in that they may have chronic diseases. They may depend on help to live their lives, but look at the smile on their faces. They seem to be enjoying their life and having good life satisfaction.
除了那些客观健康指标之外，您可能也会认为有一些主观上的指标很重要。比如说，如果我要成功的老龄的话，我一定应该是对生活满意的，一定是对自己的健康、对自己的身体有比较积极乐观的感受和感知的。总的来说，一定是要有一个快乐的老年生活，在情感上、心理上一定是非常愉快的。从这个意义上讲，我们可以想象，有些客观健康并不好的老年人，他完全可能在主观上很快乐。
So our research question will be, what do the objective and the subjective markers of successful aging, how do they define different aging profiles among the oldest old in Singapore? In other words, can an elderly person who is not physically or functionally healthy still be happy and satisfied with life?
我们的第一个研究问题因此也就导出来了。我们非常想知道，把主观的和客观的测量指标放在一起，我们可以看到新加坡的老年人中呈现有什么样的不同的面貌呢？或者说我们特别感兴趣的一个问题，也是我们在演讲开头问您的一个问题，就是是不是一个老年人如果他的身体不健康了，那么他始终还能够快乐，而且对生活感到满意呢？
And again, the more important question will be, how do these different profiles actually affect the risk of death beyond 85 years of age?
那么另外一个更重要的问题就是，在这些不同的测量指标下，不同类型的新加坡老年人是不是有不同的生存的可能性，活到85岁以上。
All right, so we did our study in a population-based cohort in Singapore known as the Singapore Chinese Health Study. This study recruited about 63,000 men and women about 30 years ago, between 1993 to 1998. When we recruited them, their ages were from 45 to 74 years old. Average age was 53. So they were all mostly middle-aged people at that time. And then we had multiple follow-up, going back to the same cohort, revisiting them either in person at their homes or talking to them on the phone to follow up, to find out how their health has changed. And in 2017 to 2019, we interviewed 1,000 participants from this cohort. So they were all Chinese. But what was common was that these 1,000 subjects have all passed their 55th birthday. So they were all 85 years and above. In fact, they were 85 to 99 years old. And the average age was 88. And so we used data from this 100 participants who were 85 years and above for our research.
我们的调查数据来自新加坡华人健康研究，这是一个追踪性的历时队列。我们最早的调查开始于1993年到1998年，在那个时候我们采访了大约63257个本地华人。当时这些受访者都身处于中年，大体上是45岁到74岁，平均年龄53岁。在未来的岁月中，我们不断的追踪 这些同样的受访者，一直到了2017年和2019年的时候，我们的调查集中的访问了1000名老年人，这些老年人都已经超过了85岁，他们的平均年龄大体上是88岁。
So in these 1,000 subjects, there were about 353 men and 647 women.
这1000名老年人中有353名是男性，647名是女性。
Okay, so let us know a little bit more about these 1,000 oldest old from the Singapore Chinese Health Study. So to be 85 years and above, between 2017 to 2019, they had to be born between 1919 to 1932. So if you remembered history, these were years before World War II in Singapore. So Singapore underwent World War II between 1942 to 1945. So these were elderly participants who were still young children or young teenagers when Singapore went through very difficult time in history. 62%, only 62% were born in Singapore. So 38% migrated from other parts of the world. And you can see that a big number, 24%, because they were all Chinese, 24% were actually migrants from China. And among those born in Singapore, majority were the first generation to be born here, which means their parents migrated either from Malaysia, in China to Singapore. So these were the migrants or children of migrants in Singapore. As mentioned, they grew up in poverty and through the World War period. And a lot of them, especially the women, never had a chance to go to school. And when Singapore was undergoing nation building in the 1960s, they were working very hard because they were considered the economic pillar of Singapore, as they were ages of 35 to 53. So our government honors them by calling them the pioneer generation of Singapore. And truly, Singapore would not have been what Singapore is today without these Singaporeans who are today in the oldest old generation.
让我们多知道一些关于这些老年人的背后的历史故事。我们知道，在2016年的时候，如果您已经超过85岁的话，那么大体上这一代人是出生在1919年到1932年的，也就是出生在二战之前。这些人有62%是出生在新加坡，13%出生在马来西亚，有24%出生在中国大陆，后来移民来到了新加坡。在这些出生在新加坡的人中呢，有7%的人是移民的后代，是第一代出生在新加坡的人。那么这些人在经历了新加坡的艰难时代，并且在1960年的时候，他们的年龄达到了35到53岁。现在我们的政府把这代人称之为立国一代。
So we found 1,000 of them and we interviewed them. So these are the characteristics of these 1,000 participants that we did our research on. So as mentioned, the average age is 88. So 80% were 85 to 89, and we had 20% were beyond 90 years old. So we know that about 65% were women, 35% were men. We know because of the history that many did not have a chance to go to school, especially the women. So 45% never went to school, never had a chance to go to school. Those who went to school, 41% only had primary school education, and only 12.9% were able to attend secondary school and above. And we also know that in these 1,000, because they were quite elderly, 67% were widowed, mostly widowed. Only a very small percent were single or divorced. The majority who who were not with their spouse were widowed, especially among the women. 33% were still married, means their spouse was still alive, but these were mostly the men. Interestingly, 9.7%, almost 10%, were living alone.
我们先看一下这1000人的人口特征。我们看到大约有81%的我们的受访者呢，他是在85岁到89岁，大约有20%的已经超过了90岁以上。从性别的分布上，大约65%是女性，35%是男性。受到时代的影响，大约有46%的人没有受过任何教育，42%只受过小学教育，12.9%才受过超过小学的教育。从婚姻状态上来看，大约67%的老年人呢，他是未婚或者是丧偶或者是离婚的状态。这部分人很多都是女性，大约有33%的人呢是有配偶的状态。这部分人中很多都是男性。很有趣的是，将近10%的人目前还是独居的。
So we asked question to measure the strength of their social network. We asked them if they were visited by children, relatives, or friends at least once a week. Do they receive phone calls from the children, relatives, or friends at least once a week? Do they have someone to confide in, to talk about their difficulties and their problems? And number 4, do they have someone to help them if they need help? So if they say yes to all the 4 questions, we consider them to have strong social support. And we are glad that 33% or 1 in 3 persons said that their social support was strong.
我们下一步描述他们的社会网络情况。我们大体上用了4个标准。第一个是不是你的孩子、亲属或者朋友每周至少访问您1次。第二，是不是他们每周呢至少会给您打1次电话。第三呢，是否有人能够听您倾诉心声。第4，如果需要帮助的话，是不是有人能够提供这种帮助。根据这些标准，我们非常高兴的看到，大体上33%的人呢，他的社会网络是很强的。
But of course, you can also say, why are you so happy? 2 in 3 did not have good social support. So we also asked about financial adequacy. This is a perception of whether they feel that they have enough financial resource to pay for medical expenses. So it is not by checking how much money they have, but just asking them how they feel, whether they feel confident, they feel secure that they have money to pay for medical expenses if they need it. And this one we can say that we are very happy that 84% said that they had to a great extent, they felt that they had enough money to pay for medical expenses. And finally, we asked whether they have regular exercise. And for this one, 74% said that they exercise at least once a week, and 26% could do better. 26% exercise less than once a week.
我们下面跟您介绍一下这些老年人的金融状况。我们问这些老年人是否有足够的钱来支付医疗费用。这个问题并不是客观的问你到底有多少钱，而是问在主观上你觉得你是不是有足够的钱来支付这些花费。我们非常高兴的看到，大约84%的老人认为，在很大程度上，他们认为他们有足够的钱来支付医疗费用。另外，我们还问了健身锻炼的习惯，大约有74%的老年人每周至少锻炼1次，大约有26%的老年人每周锻炼少于1次。
So we then measured 6 objective markers of healthy aging. The first, we asked about whether they had 8 important chronic diseases such as diabetes, stroke, cancer, heart disease, etc. And these were serious diseases that could really affect one's health. We also asked whether they could perform 10 basic activities of daily living, like feeding, being continent, bathing, grooming. We also asked about 8 activities that they would need to do to be able to be functionally independent. For example, buying their things that they need, doing simple housework, getting the meals for themselves, taking medicine by themselves, handling simple financial matters.
我们下面呢开始测量成功老龄的客观指标。我们这里要介绍6个客观指标。前3个指标呢，第一个指标我们问了老年人在是否有以下8种常见的慢性病，比如说糖尿病、中风、癌症、急性的心绞痛、心衰竭、肾衰竭、慢性的支气管、呼吸系统肺病以及帕金森症。我们还询问了所谓的第一呢是基本的日常生活能力，包括呢进行10种日常基本活动的能力，包括进食、洗澡和大小便。我们还询问了相对来说比较高级的日常生活能力，比如说可以去买东西，可以做家务，可以准备食物。
The next 3 objective markers refer to a measure of their cognitive function, and then we use a questionnaire that is commonly used by doctors to screen for dementia. We also measured how active they are socially by asking whether they participated in social activities, joined senior club events, or attended a place of worship, such as the church, at least once a week. And if they say yes, they were regarded as being socially active. Finally, we asked if they were being productively engaged. They were engaged in productive activities, and these included doing paid work, or they were volunteering in community work, or they were helping with grandchildren and doing housework at least once a week. If they say yes, they were considered to be productively active.
我们另外还涵盖了3个客观指标。第一个客观指标是认知能力，我们用一个30个问项的量表来测量老年人的认知能力。下面呢，我们还引入了关于他社会活动和社会参与的指标。如果经常参与社会活动，参加老年俱乐部活动，或者至少每周1次的参加宗教活动，我们就认为他是社会活动方面是很积极的。最后一个客观指标呢是生产经济活动的指标。我们问老年人是不是有参与有偿的雇佣活动，或者是无偿的义工，或者是在家做家务。
Then we have 6 subjective markers of healthy aging. The first 3 markers here, one is a self-rated health. We asked them a very simple question. In general, would you say your health is, and we gave them a choice of 6 answers: poor, fair, good, very good, and excellent. Sorry, 5 answers, and excellent. And then we considered good, very good, excellent to be good self-rated health. We also asked them whether they were satisfied with their ability to do their daily living activities. So again, this is a subjective assessment. It is how they feel, whether they are satisfied that they are actually quite, happy with how they cope with their activities in life. And then we also ask them a question on whether they are happy with their memory and cognitive function. So for these, we asked them not 1, but 13 questions, asking them whether they feel that their memory is good. Do they feel that they are still able to, learn new things? Are they still able to remember what they need to remember so that they could live their lives without being dependent? And so this is, again, how they feel about their about their memory and cognitive health. So I'd like to go on first, and then we'll have Prof. Fain to translate. The 4th one is we ask them about how satisfied they are with their personal relationship. Again, it is not we judging if they are good, but asking them, how do you feel? How do you feel about your relationship with your family, with your friends? Are you happy with your relationship? Then we ask the 5th question about life satisfaction. We ask them, questions about whether they feel that they are happy with satisfied with their lives. Questions like, have you gotten the important things you want in life? And questions like, if you could live your life over again, will you change anything? So we have, 5 questions to measure life satisfaction. Finally, we have 15 questions that doctors routinely use to find out whether there are depressive symptoms in the elderly. So this is called the geriatrics depression scale. With 15 questions, we ask how the elderly feel about their emotional being. Questions like, do you feel hopeless? Do you wake up feeling that your life is good? Do you wake up feeling that, that there is nothing to live for? So we have 15 questions to measure symptoms of depression. So these are the 6 subjective markers to measure mental and emotional health.
相对于刚刚我们提出的6个客观指标，我们同时也测量了6个主观指标。这主观指标呢，主要是问老年人自我的感受。比如说，第一个指标，自己评价一下自己的健康是否是坏、一般、好还是非常好，这5个档次。第二个指标，我们不去问日常生活自理能力有还是没有，而是去问你对自己的日常生活自理能力是否满意。第3个指标，我们问了您对您的认知能力、对自己的记忆能力是否感到有怨言呢？同样的，第4个指标，我们问您对您的个人的关系、社会关系是否是感觉到满意的。下面的第5个指标，我们问您对您的生活是不是感觉到满意的？这里有从1到7的7个档次。最后一个主观指标呢，我们采用了15个问题组成的抑郁量表来看，这位老年人对自己的生活，是不是早上起来以后充满了希望，还是觉得生活没有意义？总而言之，这6个指标和前面的6个客观指标构成了强烈的对比。前面的6个指标是客观的，目前的这个6个是主观的。
Thank you. So first of all, let's see how our 1,000 participants, what their scores look like. And here we look at, the 6 objective indicators first. So we are going to see how many have done well. So we find that about half, more than half, 53%, do not have the 8 important chronic diseases. That's pretty good. About 66% said that they were independent in the basic activities like bathing, continence, feeding themselves. 37% were independent in the 8 functions of daily living, like shopping, getting their own medicine, looking after their own meals, housework, finance. 37% were completely independent. 73% passed the cognitive test and were considered to have intact cognitive function. 34% were socially engaged, in social activities, religious activities, and 70% were doing productive activity at least once a week, which included either being paid for their work or helping out in the community or in their homes.
让我们首先来看一看，老年人在6个客观指标上的表现。我们可以看到，大约有 53.8% 的老年人没有任何的慢性病，65.7% 的老年人在基本日常生活自理能力上是不需要任何帮助的，可以独立的。37.1% 的老年人在高级日常生活自理能力上是可以独立的，可以去买东西，可以去做家务。但有 72.8% 的老年人在认知能力上是没有问题的。有 33.7% 的老年人，他们至少每周有1次呢会有社会活动和社会参与。最后 70.2% 的老年人每周至少参加1次呢生产经济的活动。
So for the subjective indicators, we have 32% of our 1,000 participants who said that their health was good. So actually about 70% didn't think that they had good health. even though we see that about 38% only 38% were independent, 62% said that they were satisfied with their ability to perform functions in their life, right? So again, this is subjective. So 62% were satisfied with their ability to do their activities. Again, we see that although only 73% had intact cognition, 87% felt that they were good with their cognition or their memory. 87% had no complaint. They say, yeah, okay, I think my memory is still very good compared to my peers. I'm still okay. Here we have 65% who are happy with the relationship in their lives. 78% felt that they were satisfied with their lives. And 82% did not have high score for depression. They scored low for depression, suggesting that they had pretty good mental health.
那我们下面再来看主观指标上的表现。大约有31.8%的人认为他的健康情况是好的。可是后面的结果呢很有趣，我们可以对照。在客观指标上，大约只有37.1%的人呢，在高级自理能力方面是独立的。可是呢，在自理能力的满意程度上，有62.3%的人很满意。在我们的客观测评上，72.8%的人没有问题。但是呢，我们在主观的评价上，87.2%的人没有任何怨言。这个两个指标的对比也是很有趣的。我们下面继续看，大约有65%的人呢，他对自己的生活关系是满意的。78.2%对自己的生活是满意的。81.4%的人在抑郁量表上得分很低，证明他们没有很多的抑郁状况。
All right, so we decide so if everybody has subjective score and objective score, we were able to put people on the graph with the x-axis, their score for the objective markers, the 6 objective markers, and on the y-axis, we had the score for the 6 subjective markers. And we put the data together for these 1,000 subjects to see where the scores were when we plotted them on the graph. And this is the interesting finding. So you might say, well, I'm sure people who were high in objective markers, they were healthy, they were functional, they were independent, they must also be feeling happy. They were satisfied and they had no complaints. Indeed, we had 44% who were in this group, and we call this group the fit and positive people. Then you must be thinking, I'm sure there were people who were not healthy. They had chronic disease. They could not be independent in their daily lives. They needed help. Their cognition was not good. They were not socially active. Surely these people must also not be satisfied. They were not happy. Maybe they were depressed. So these people would be low in both objective and subjective markers. So this is the group here in green, and we called them the frail and dejected. And this was 13% in our study. Then we had the people who were in the middle, kind of the people who were sort of between the two groups. They were not so healthy, not as healthy as the fit group, and they were also less satisfied and happy as the positive group here. So their scores were sort of in the middle, and they were known as the fairly fit and neutral, fairly fit and neutral, neither yes or no, some diseases, a little bit of dependence, and so on. But the most interesting group is this group in yellow. So these individuals, if you look at their objective score, they were not much higher than the frail group. So they were quite frail themselves, meaning they had diseases or they were dependent for people to help them in their daily lives, or their cognition was not as good, or they were not very socially active. And you might think, well, what about their subjective markers? And you will be surprised to see that they actually rank quite high. They rank as high as the fit and positive group. So which suggested that they were happy, they were satisfied with their lives. And if you ask them, are you happy with how you're living your function? And they probably say, yeah, well, I'm quite satisfied. So this was an interesting group. And we thought, yes, they were frail, But unlike the frail and dejected, they were happy. They were coping mentally and emotionally. So we called them the frail but resilient group. And this group was about 25%.
我们下面可以按照客观指标和主观指标，把我们所有的1000人中同时放在这样的一个空间来看。客观指标由低到高，主观指标由低到高。这样的话，我们看到了非常有趣的分布。我们第一组可以看到的是非常高的客观指标，同样也非常高的主观指标。那么这组人呢，显然是既健康又开心的一组人，他们大约是有43.9%。可是另外一组呢，我们可以看到呢，相对而言呢，客观指标比较低，而主观指标也比较低。这类人呢，毫无疑问，我们可以称之为呢不健康、不开心的一伙人。可是除了这2组之外，很有趣的是，我们看红组，红组的人呢，大体上呢是比较健康的，在他的主观评价上呢，心情上呢也是一般的，不是特别负面的。我们称之为大体健康、心情一般的一组人。最有趣的是黄组，他们呢在客观健康上得分很低，所以他们不健康。可是呢，他们在主观上很快乐，我们称之为不健康但是有韧性的一组老年人。
So I'm going to just show you, again, don't worry about the numbers, but this is to just show you that when it comes to the objective indicators, the yellow group, the frail but resilient group, the numbers, which is the probability of them having the positive objective markers, their scores were more like the green and dejected group. However, in the subjective indicators, the score of the frail but resilient group for the subjective markers, their scores were more similar to the fit and positive groups. So these are the numbers that substantiated the graph that you saw previously. I only want you to take note that for the objective indicator, when it comes to social engagement, which is to have activity with friends outside their family or in the church or in the community at least once a week, the frail but resilient group was more like the fit and positive group and was higher than the fairly fit and neutral group. It was the likelihood of 34% and 44% versus the lower percent in the frail and dejected and the fairly fit and neutral group.
我们下面啊，再用另外一个角度理解刚刚我们给您展示的那幅图的4组人。黄色组的人就是我们所说的不健康但有韧性的这组人。我们观察这黄色组在所有的健康的这些指标中呢，我们看到黄色组和不健康不开心这组呢是很类似的。您看慢性病也好，日常自理能力也好，认知功能也好，它在健康上和那不健康这组人很相似。但是在另外一张图上，我们看到它在所有的主观的感受上，相反和健康乐观那一组人更加类似。这就是这组人在这2种对照的冲突中的一个特殊的一个对照。可是呢，我们还要特殊的提出呢，关于社会参与的这个维度。社会参与这个维度，我们发现黄组呢和乐观积极组是很相似的。
So we have the 4 groups, and we also found that compared to the frail and dejected group, which is the worst group, the other 3 groups were more likely to feel that they have enough resources for their medical expenses, and they were also more likely to be engaged in weekly exercise. Again, we also saw that the fairly fit and neutral group and the fit and positive group, because they were healthier, they were more likely to be staying alone, and they reported to have stronger social network compared to the two frail groups.
我们进一步的分析发现呢，其实呢，对照呢不健康不开心的这组，这也就是最不好的那一组。其他的3组呢，他们更有可能呢告诉我们，他们有充足的金融资源足够的钱来支付医疗需求，他们也更有可能呢去参与每周的健康的锻炼活动。另外一个发现呢，我们发现呢，健康乐观组以及呢大体健康心情一般这2组呢，他们更可能呢会独自居住，也更有可能呢会汇报呢有更强的社会网络连接，和其他2组相比。
So this is the second most important result. So the first one is the discovery of the 4 groups. The second important finding is what happened to the 4 groups after we met them and interviewed them. We followed them up for about 3.5 years, over 1,400 days, so it's about 3.5 years. And what we found was what we did was to trace their survivor. So if you see the line coming down, this means the percent that is still alive. So if you see the numbers going down, this represents, loss of survivor due to death. And we find that the group that is going down the fastest, with the poorest survivor, which is this line here, this is, as you would guess, the frail and dejected group, because they had the most problem with objective markers of healthy aging. Many of them were not healthy, they had diseases. So it's not surprising that this group here had the lowest survivor or the highest risk of death. The group that did the best is the line here. And if you have to guess, I'm sure you'll say it must be the positive and fit and positive group. Indeed, they had the best survivor. You can see that, they had the slowest drop in survivor, which means a lower risk of death. How about the 2 groups in the middle, the fairly fit, fairly neutral, and more importantly, the frail but resilient group? And these 2 groups were actually pretty similar. You can see the 2 lines were kind of, on top of of each other, suggesting that actually these 2 groups had quite similar survivor and quite similar risk of death. So if you remember that the fit but resilient group were actually if you remember that the frail but resilient group were actually almost as unhealthy as the frail and dejected group, yet they had better survivor. In fact, they had a 37% lower risk in death compared to the frail and dejected group. This implied that because this group, the frail and resilient group, by having a better mental health, better resilience, better emotional health, they seem to be able to have better survivor despite being equally frail as the frail and dejected group.
我们刚刚区分了4个组，这只完成了研究的一半。那么更重要的是，这4个组到底有什么样的意义呢？我们追踪了这4组人群，大体3年半的时间，也就是大体上1200到1300个日子。在这些日子里呢，我们可以呈现出他们的生存曲线。这个生存曲线呢，实际上我们可以看到，每一组都是起点在100%的人，但是随着老年人的不断的故去，曲线逐渐下降。我们看到这个4个曲线中最低的这一个，也就是死亡率最高的这一组，其实就是我们刚刚所说的那不健康也不开心的那一组。相对而言，您可能很容易的就猜到了，最上面的那一组，也就是健康和乐观的那一组。那么有趣的是，中间这2组纠缠在一起，似乎很相似。也就是说，大体健康心情一般这一组呢，和不健康但有韧性这一组，似乎是有相似的死亡风险曲线。这让我们回到最初的那一个问题：当我们的客观健康都不健康的时候，那么 心理上是否乐观，就可能起到一个对生存有积极的推动作用。我们比较不健康但有韧性的这一组和不健康也不开心的这一组，我们发现不健康但是有韧性这一组的死亡风险率降低了大体37%。
So, in summary, we found 4 types of successful aging profiles by using objective and subjective markers. So we had the fit and positive group, we have the frail and dejected group. Of interest will be the frail but resilient group, where the oldest old may fail in the objective criteria, but they have positive subjective appraisals.
让我们来总结一下我们研究的主要发现。我们的研究的第一个主要发现呢，是我们根据客观的指标和主观的指标，鉴别出了4种不一样的成功老龄的类型。这4种成功老龄的类型中最有趣的一组是客观上不健康，但主观心理上很快乐、有韧性的这一组。
So this shows us that, the age-related perception, feelings, and well-being are not just influenced by your objective condition, but also by your psychological processes. So by social comparison, an oldest old who is dependent on people for their daily living may still have high level of satisfaction in life, because when they compare to their other friends, they may feel that, hey, I actually I may not be that bad, I think I'm still doing better. So instead of focusing on the glass being half empty, they look at their glass as being half full and still enjoy happiness in their life. In the same way, an oldest old may also choose to just accept help from people to cope with their lives, or to say, I can still go out on wheelchair, even though I cannot walk on my own, and in turn still be satisfied with their life.
那么我们的发现有一个很重要的提示，那就是好像是对老龄有关系的那些感知可能并不完全是由生理的客观的指标所决定的，它也同样的受到心理的和主观的那些过程的影响。比如说，有的老年人在评价自己的健康的时候，如果和年轻人相比，当然我们的健康是不好的，可是我们也同样可以跟自己同龄的朋友比说不定我的健康还很好。这就好像看着一杯水有一半喝完了，你看到剩下的一半呢，还是看到那空掉的一半，这完全取决于您的心态。另外一个例子是，即便生理上、客观上出现了种种的障碍、困难，老年人也可以主动的应对它、解决它，从而使自己对生活有一个乐观的态度和感知。
So emotional and mental health may affect the risk of death. And we find that other studies have shown that if you have positive emotion and you are highly satisfied with your life, the level of stress hormones in your body may be lower, and you can have better function of the immune system. And we know that if your immune system is stronger, you will have better survival from diseases and lower risk from chronic diseases in old age. Finally, psychological adaptation through development of resilience may therefore offset the bad effect of objective adversities on your health.
我们发现，我们进一步重要的发现呢，我们发现呢，感情上和精神上的健康实际上对生存风险有很大的作用。我们发现呢，积极乐观的态度，对生活的高度的满意，有可能会减少压力所带来的一些的荷尔蒙的分泌，并且呢会提升免疫系统的运作。这种种的生理机制都会导致死亡率的降低。另外，在心理上的 通过不断的强化心理韧性所导致的种种适应性的行为，也可能使健康的种种问题的负面影响消失啊。
So what are some practical steps we can do to apply the findings? First, our study showed that in general, among the oldest old, the level of social engagement is not high, and we can do better. We can recommend interventions to enable the oldest old to leave their household and take part in social activities face to face, especially now that COVID restrictions have been lifted up. And important in a very important task that we can do is to have interventions to improve digital literacy amongst our oldest old, so that they can be socially engaged in online platforms. They can go online and watch a Zoom seminar, even though it may be difficult for them to come out in person to attend it. They may also communicate with the younger generation, their grandchildren, for example, using social media, using WhatsApp. And these are all practical ways that we can do to help our oldest old be more connected with society.
我们的发现的现实意义在哪里呢？我们应该如何去更好的用这个研究去改变现实呢？首先呢，我们发现在社会参与这方面呢，目前呢，新加坡老年人口还有很大的提升空间，所以我们建议呢，要不断的进行干预，使我们的老年人呢能够走出家门，认识更多的朋友，参与更多的社会活动。在当下的数字互联网时代，我们也希望呢，老年人掌握数字技能、计算技能，跨越数字鸿沟。在这个方面呢，子女孙子女在家庭里呢，要不断的帮助教育老年人使用现代沟通工具，参与现代的社会生活。
And in the introduction, we heard about the activities organized by the SAGE Counselling Centre, including the reminiscence talk, the guided autobiography. And these are really useful counseling programs to help the elderly have a constructive appraisal and reinterpret the meaning of their life events, even though they may be sad events, negative events. We could help the elderly go through these memories and build resilience and have a better mental outlook, better emotional outlook in life.
我们也同样呢，希望有更多的像乐龄中心这样的咨询服务，来帮助老年人克服心理上的困难，尤其是进行对负面的生活经历的重新解释。从而让老年人振作信心，有更乐观的心态。
So finally, our data also suggests that factors such as feeling that they have adequate financial resources for medical needs is important among the oldest old. And it is also important to promote regular physical exercise among our elderly to help them maintain a successful aging profile.
最后呢，我们也发现了有2个因素对促进健康老龄生活有很重要的影响。一个是呢，要提升老年人自我的金融的这种满足感，要让这个老年人的时候感觉到有钱够花。第二个呢是维持有规律的健身活动。
Yes. So in conclusion, I hope our findings, our research data have shown that in order to have healthy longevity, it is not important just to keep oneself free of chronic diseases, but to also be happy and stay active.
最后呢，我们的结论就是，为了使我们广大的老年朋友能够健康长寿，这不仅仅是一个医学问题，要无病无灾。同样，我们希望老年人能够乐观快乐。
Yes, so I've come to the end of our talk, and we'll be happy to answer questions that you may have.
我们的演讲到此结束希望大家有问题我们可以解答，谢谢。
Okay, thank you, professors. Thank you, Professor Ko and Professor Feng. 谢谢两位教授。那在我们进行问答环节之前，我先给大家做一个小小的活动。Okay, so before we proceed to Q&A, there is a gentle call requesting for your help in completing our feedback. This feedback will help us to continue to provide free webinars to all, and it will be conducted in a short poll that you will see on the screen right about now. Okay, so there are 4 multiple choice questions, and if everyone sees it, please take a minute or 2 to complete the poll. We will start the question and answer right after this, so please don't leave yet. So 谢谢教授们，希望这些内容对各位有帮助。那在进行问答环节之前，我先打个岔。每个人的反馈会帮助我们继续为大家提供免费的讲座。反馈会以小小的投票活动进行。那各位在屏幕上有没有看到问题 ？OK， 很多人已经看到了。OK， 那请大家帮忙参与投票，之后我们会开始问答环节了，所以先别离开，谢谢。OK， 那些已经回答那个小小的投票活动的朋友们，你们如果有什么问题，也可以把问题留在我们的 chat 或者 Q&A 的页面。So for those of you who have finished the small poll, we welcome questions. So if you have thought of any questions for the professors, you can leave them in the chat box or the Q&A box. Okay, maybe about 20 more seconds. So those of you who are finishing up the last question, there's still a bit of time. Okay. 我们即将要结束投票活动了，所以大家已经做好了吗？Okay. I will end the poll here. So thank you everyone. Don't worry if you haven't finished the poll, because the feedback form will be displayed automatically after the webinar ends. And I will also place the link to the poll in the chat box for everyone. So if you do have a more detailed comment for us, you can also fill in the form. OK， 所以投票活动结束，谢谢大家。还没完成投票的，别担心，在我们结束讲座后，反馈表会自动显出。我也已经把连接放在聊天室里。那我们就马上进入问答环节。OK， 提醒大家在 Zoom 聊天室里或者 Q&A 的问答室发问。Okay, so I do see some questions in the Q&A box. So The first question for the professors is, the older generation may have better resilience. How about the younger generations, Generation X, Y, Z? How will they fare in old age? Does any Prof. Ko or Prof. Feng, any thoughts on that?
I'm going to ask Prof. Feng, who is the sociologist professor, to comment first.
OK，
Prof. Feng 是社会学博士教授，我让他回答这个问题。
好的，谢谢。谢谢thank you Wenpei to give me the hard question, and also thank you for raising this very meaningful question. Shall I speak in English and then translate by myself into Chinese? I think first of all this question is exactly meaningful because it is very right that the different cohort will have different perceptions about life and have different ideology, have different norm and culture. And therefore, it's very reasonable to predict they may have different degree of resilience. So first of all, I admit that the young generation may not be as resilient as the older generation. That's very possible. But on the other side, I would like to say this is really a social construction procedure. It really depends on how society transport and transfer the value of Singapore older generation to the young generation. The whole society, through education system and through multiple mechanisms, could actually educate the young people to learn the difficulty and hardship of older generation, and therefore make them to be more resilient towards the future, which is full of uncertainty. Okay, that's my question. Shall I just translate it very briefly? 我认为这个问题很有意义。首先，我认为年轻一代和年老一代，由于不同的历史境遇，他们很可能对生活有不同的看法，因此呢，他们的心理韧性也完全有可能不一样。在新加坡来说，年轻一代比年老一代有更少的心理韧性，这是有可能的，但这又不是一个绝对的答案。心理韧性是一个社会建构的过程，需要社会的各个方面去帮助年轻人成长，不仅仅通过家庭、学校等各种教育的机制，使年轻一代能够学得年老一代的优秀品质、心理韧性，这可能是我们共同期待的未来。谢谢。
谢谢你，冯教授。Thank you, Prof. Feng. Okay. So, Prof. Ko, do you have any comment on that, or shall I move on to
Just move on. Yeah,
Okay.
It's an excellent answer.
Okay. So another question is, one of our friends, he's asking, the research study was done 30 years earlier, and so he's curious, how could the results benefit healthier SG today?
So I want to clarify that no, the research study wasn't done 30 years ago. The cohort was recruited 30 years ago. When we recruited them, the participants that we studied were about 60, 65 years old. We only studied in between 2017 to 2019 when they were 85 years and above. And when we looked at then we followed them up for about 3.5 years to look at survivor. So we only published a paper last year. And so the results are actually still very relevant. So Healthier SG, of course, is the government's plan to keep Singaporeans, healthy in terms of keeping chronic diseases down, early prevention, early detection, and early treatment. But I think, of course, we now recognize that besides medical condition, medical health, physical health, there is the mental health aspect. And, it is an important aspect. Then I think there is a lot of interest and emphasis on mental health, not just among our young people, but we should also look at mental health among our elderly. It's not about keeping our elderly alive, keeping them fit, but it is also about looking into their mental state, their emotional state, you know, in order to help them live, enjoy healthy longevity. Yeah. I don't know whether yeah, Prof. Fei want to just quickly summarize for me in Chinese.
Yeah, 我可以翻译一下。感谢您的问题。我们的研究并不是30年前开始的，实际上这个研究就是最近几年才开始的。我们刚刚才发表了这个论文。这个数据呢，当然是追踪的数据，当然是30多年了。第二个，您提到的就是说对现在的新加坡的 Healthy 新加坡的这个项目有什么意义呢？我们想说呢，我们目前政府的项目可能更多关注于对健康问题早发现、早预防的这样的一个思路。我们的研究呢，其实鼓励呢更多的关注心理健康的方面。心理健康不仅仅是年轻人和成年人的问题，我们同样要关注老年的心理健康。谢谢。
谢谢方教授跟徐教授。Thank you, Prof. Ko and Prof. Bang. So, okay. So someone is asking on a personal level, how can someone be more emotionally resilient? Any tips for her, for him or her?
Yeah. I think from our study it shows that the frail but resilient group, one characteristic that made them different from the frail and dejected group is that they were more socially active. You know, they spent, and that was in response to the question, do you at least once a week spend time with people outside your family, you know, whether it's in the community, friends, or, you know, religious group. So I think one answer from our study would be that it is important, I think, to not to be alone, but to be with people who could support you, who could, you know, help you look at life from another angle. You know, and like, for example, you know, by being with other people, sometimes you realize that maybe my problem is not so difficult to overcome after all, or you could get advice from friends and can confide in other people to help you. So I think to be emotionally resilient is really to be with people who can support you. Don't be alone. And in that sense, it is very important to make sure our elderly, especially those who stay alone, who may be healthier, because that's why they can stay alone, it's important to look at their mental and emotional support. Yeah. So I'm talking about emotionally resilient for the elderly population. Yeah.
许教授，这个问题是如何在情感上能够有韧性？许教授的回答是这样的，我们的研究发现，其实情感上更有韧性的这伙人，他可能更加积极的参与社会活动。更加积极的参与宗教活动，有更好的社会交往。晚年生活可能充满了各种各样的波折困难。在这种波折和困难的情况下，有你的好朋友，有你的好朋友家人陪伴着你，可能是增加心理韧性的一个最主要的途径啊。谢谢。
Thank you, Professor. 谢谢教授们。Okay, in the interest of time, maybe we can answer the last question for tonight. Time has been running out quickly. Okay, so to follow up on the previous question of emotional resilience, you know, one tip for seniors is for them to be more socially active. So one of our friends is asking, so first he said that he agreed with the findings that if we can engage the seniors and get them to join weekly face-to-face activities, it will help them to be more positive and live longer. But he do encounter some seniors who just don't want to leave their homes. So professors, do you have any thoughts on how we can help the seniors to move out of their comfort zones?
I think this one, ask Prof. Fei to give his answer. Maybe I can translate in English.
Okay, thank you very much. Let me try to. This is actually also one of the major problem for sociologists as well, because we are trying very hard to understand people's life. But for those older people, when we try to do survey or do qualitative interview, and some of them close the door. We have never have a chance to talk to them, and therefore can never have a chance to understand their life completely. This is very sad, and we also hope to open their door. Okay, that's one side of my answer. But the other side of my answer is we should give them the full sympathy for those older people to stay at home, and do not blame them. That's my basic baseline answer. By working with Professor Cohen Bay, I heard a story that one older people do not want to get out of their door simply because she is afraid of fall, and then the falling may cause trouble for their family, and therefore she decided to stay within home. I think this is a choice based on love, and that's why we really should put great sympathy on those older people to understand them from their own perspective. Yeah, that's my answer. Yeah.
Okay, thank you, Prof. Feng. 谢谢冯教授. Okay, I do see one more question that I think is quite related to the sharing just now. So maybe I'll just quickly add it in. Okay, so someone is asking, would the frail but resilient group of seniors prolong their living years in poor health?
With the frail but prolong
frail but resilient group of seniors prolong their living years, even in poor health.
Yes. So I think this is where we look at the question, we look at health in totality. So, I'm medically trained and I'm a medical scientist. And, in the earlier, in my earlier part of my research, I was always looking at how to prevent diseases. And as if if you contract disease, then, you have failed and the doctor has failed. But now that I have started to do aging research, and especially, from the collaboration with Professor Feng, I've realized that, longevity is not just living longer. We're talking about healthy longevity. But healthy longevity is not just living longer in good health measured by the doctor. It is also it also includes social and emotional health. So yes, it may look at the frail and resilient group and say, oh, but they're frail, so they live longer than the frail and dejected group, but they're living in poor health. But if you remember their subjective markers, their depressive symptoms were low, they were satisfied with their lives. And if you ask them whether they were satisfied with how they were living and coping with life, they were also happy. And I think it is, if you ask them, if you look at this and say, well, do you think they have lived longer but really be miserable? Then the answer is actually no. From the data, they were living in longer life. They were living longer life. Their health was not objectively that good, but subjectively, emotionally, mentally, they were healthier. So I may say, yes, they were living longer. Their health was not as good, but I would not say that they were sad, they were miserable. And I think that's what we want to do. We want our elderly to live longer, in happily. And even if their health may not be as good or maybe poor, we hope that the remaining years may actually still be years where they could feel satisfied, they could feel happy, and this is as measured by their subjective markers. I don't know if I'm very, hoping to have Prof. Feng weigh in on his answer, to have his comments. Don't translate, but I'd like to hear your thoughts on this.
Yeah,
it's a very good question. I think it's a very good question.
谢谢我同意许教授的说法。第一呢，我觉着健康应该是多维的。从生物和生理的角度上来看，我们所鉴别出来的这一组人，确实他们的生物生理健康可能是较差的，但是他的像如许教授所说，他的社会层面的、他的情感层面的、他的心理层面的健康是富足的，是非常好的。 那么这样的一种老年生活，我们应该鼓励。也就是说，有可能有些生理和物理上的健康是不可避免的衰弱了，但是我们同样可以通过自身的努力，通过自身的应对的策略，通过自身的社会支持网络，呈现出一些韧性。而这里最关键的一条就是，我个人不知道许教授是否同意我。我认为 the first line of defense should be ourselves。我认为可能最初的那个防线是自己不认输，而这也是新加坡人的很宝贵的那个立国的精神，就是不认输，要战胜这个困难。自己首先在心理上不认为老年就一定要过得不好、不健康，即便有了生理上的不健康，也一定要振作精神，保持乐观，这可能是一个解决的方案。
Oh yeah, I definitely agree. And you will hear doctors, giving, stories of how their elderly patients could beat cancer, beat diseases that were, deemed, to be quite terminal, just because they had a positive outlook. So I also want to say that, medical sciences have come to a stage of advancement that doctors are very good keeping patients alive. But I think here we are not talking about, how many years they live anymore, whether health was good physically or not. But I think the mental health aspect is important. So I would like to say that they may live in poor health from the objective markers point of view, but what's important is that they don't live in sadness, they don't live sad years from the subjective markers. Yeah.
Okay. Thank you, Professor. 谢谢教授们. So unfortunately, that is all the time we have for tonight. So 谢谢大家踊跃的参与问答环节. So before I conclude, may I check with professors? Do you have any concluding remarks to add? Yeah.
Well, I want to say that I am, very impressed by the activities organized by Sage Counselling Centre. I hear about the activities. Before our talk, they were talking about the activities that they are doing, the reminiscence talk, the creativity among the elderly, the guided autobiography to help them think about their life in the past. I think these are all excellent. And these, if you ask me, how do we promote resilience among elderly, I would say join the activities of Sage Counselling Centre. And it is truly an honor, truly a privilege for me and for Prof. Fain to be able to come and share the findings and to, help provide you with evidence to help provide evidence for promoting these activities and getting more participation among our elderly to keep our elderly happy and resilient.
Thank you, Prof. Ko. Prof. Ko?
Let me speak in Chinese, okay? 非常感谢大家今晚参与我们的活动。我祝在座的所有的老年朋友们，不仅健康长寿，而且要快乐健康长寿。谢谢。
谢谢方教授。Okay, so a big thank you once again to Prof. Ko and Prof. Fong and our wonderful online friends tonight. We hope that you enjoyed our talk and found it useful. So I'll just quickly do a recap about our main services, just to reinforce what Professor Ko said. So mental health for our seniors is important, and at Sage we offer counselling, right, which is important for mental health. So it is free for Singaporean citizens and permanent residents. You can always call us to find out more. We also have the Seniors Helpline, which is a free national helpline with an easy to remember number. So that is 1-800-555-5555 for anyone aged 50 and above who is seeking a listening ear. So 现在我来简单的重复一下乐龄辅导中心的服务。就像许教授刚才说的，辅导有助于取得良好的心理状态，所以我们的辅导是免费提供给50岁及以上的新加坡公民和永久居民家属和看护者。我们也有一条免费的援助热线提供给50岁及以上的人士，号码是1800然后7个5。所以需要聆听者的人不妨打进来。 Okay, here we also have a short announcement on our next month's talk. So remember how the professors also talk about how it is important for seniors to keep up to date on technology. We are also honored to have an NTU professor to share about technology and aging. So this talk will be on 25th of May, also a Thursday, and the same time, 8 p.m. on Zoom and in English. So registrations are already open, so you may visit the link to sign up. I will put it in the chat box for everyone. OK， 那大家还记得教授们有讲年长者应该就是持续的关注科技的发展吗？那现在你的时机到了，因为我们下个月的讲座就是科技是老龄化的未来，所以是个英语讲座。我们很荣幸邀请到南大的教授来演讲。日期是5月25号，是个星期四，同样的时间晚上8点。如果有兴趣的，可以扫描屏幕上的 QR 码，或者用我们的连接。Okay, so for more updates on our activities, do follow us on our Facebook page. And for any other questions, we are also just an email or a phone call away. So thank you once again for joining us, and hope everyone you have a good night. So 好的。这就是我们今晚所有的时间。有关更多乐龄辅导中心的信息，请关注我们的 Facebook。任何其他的问题可以致电联络我们。那再次感谢大家参加今晚的讲座，祝大家平安健康，晚安，大家拜拜。Professor, someone is asking, is your research paper published online or anywhere? Whether
yes,
they can have a look at it.
Sure, it's been published, yes. So can I email it to you?
Can.
And then you can share. Yes, of course, it's published. It's been peer reviewed. It's published in the international journal. Yes.
Okay.
We also shared this with Straits Times and Zhao Bao, and I think.
So I can also share the newspaper article.
Yes, I can give you the Straits Times link and the Zhao Bao link and some, yeah. And I think Prof Feng was on, were you on TV or radio? Or, no?
没有啦，我就知道有早报的啊。
有早报的。And then 我看还有 you know, if you do a search, sometimes social media will pick up from Straits Times, pick up from 早报. Yeah.
对。
Yes.
Okay, can. So if Anne, you're still here, we will we will share the.
I see. Oh yes, I can actually do it now, right?
Oh, okay, also can. Yeah.
Could you have a copy? Oh, how do I append? Could you have
I can type the answer. So if you have the link ready, you can just share it. If not, I can follow up.
If you follow up, if you can follow up, yes.
Okay,
yes.
Can.
Someone said, K. Choi, knowing research was done in Singapore to help. Yeah, very heartening. Yeah, yes, we have a lot of research. Now the two schools have combined forces. School of Medicine and the School of Arts and Social Science, Faculty of Arts and Social Science. Because aging is not just medical, it's social as well, you know. So in fact, even engineering have come in, you know, to use devices to know how to help the elderly live better. And you know, it's a interdisciplinary approach.
Yes.